Welcome to Maryland Health Today. I'm Ellen Beth Levitt. Adolescence is a time of transition from childhood to adulthood. During that time, there are some important health issues to consider, and we'll be talking about them on the show today. My guest is Dr. Lehia Peralta. She's the head of Adolescent and Young Adult Medicine at the University of Maryland Medical Center, and she's also an associate professor of pediatrics at the University of Maryland School of Medicine. Welcome to the show.
Thank you.
What is the age range of adolescents that you care for? What is the age range of your patients?
The definition of adolescent has changed in the last 5 years. Initially, we were seeing patients from ages 12 to 21, which is where we define as the time of puberty. From the onset of puberty, which usually is before 12 years of age, to 21. However, now we have extended that to age 24 to include young adults because there's new research indicating that still development occurs from ages 21 to 24. Growth development, physical development, and mental development.
Well, that's very interesting. Well, what are some of the health concerns in this population that you treat? Our
patients vary as a really wide range of ages, from the very young ones, what we call early adolescents, usually ages 12 through 13, 14, and then the middle adolescent, 14 to 16, and then the late adolescents, who are the ones who are preparing to go to college. Initially, the young adolescent comes with many concerns about their bodies, their physical development, how they are doing in terms of growth. They compare themselves with their peers.
Oh, sure.
Then in the middle of the range, those are the adolescents that become very famous at home. Those are the ones who start having struggles with their parents, who want to be independent, and the family conflict becomes really a major issue at that age because they're experimenting. They're already more comfortable with their bodies, but now they're really looking for their own identity, experiencing with their peers, and that's where the risk behaviors start. So many of them are concerns about risk behaviors, and those are some of the topics that we also address at that age. And then later on, when they are going to college, then they are more prepared, they are more mature in terms of how they think about their future career, spirituality, religion, and that's a time when they use really the family as a platform to prepare them for their new careers in college.
Interesting. Well, I understand that you like to have a screening visit with new patients, and maybe you could tell us a little bit about what that involves.
Yeah, the screening visit is a very important time because it's a time when adolescents come to us and we have a private visit with them, not necessarily with the family, the entire family involved, but just with the adolescent.
Oh, so you advise the parent to let you talk just one-on-one with the child or the adolescent.
And I think most parents are really comfortable with that as well because it's the first time that they can talk to a doctor about issues that they are concerned about, and perhaps they are too embarrassed or too uncomfortable to talk to their parents about those issues. So this is a great opportunity that we have. We also interview the parents at the same time, and simultaneously in 2 different rooms, and then we put them together to be able to discuss the issues that, the health issues, the sensitive issues that perhaps the adolescent is comfortable now with us to really guide them on how to talk to the parents about issues that are more sensitive to them.
Well, what are some of the issues that you like to talk to the adolescents about?
We discuss issues beginning with alcohol, substance use, what is it, what they are experimenting with, what their peers are doing, because this is the time when they relate to their peers and also they try to follow those behaviors. So this is an excellent time to start discussing that. Also, we talked about abuse in general, physical abuse, emotional abuse, and sexual abuse. Many adolescents, especially those who develop early and their bodies is growing, perhaps those are the early developers, years, those are even more at risk of those kind of abuse because developmentally their brains are not up to speed yet, but their body looks like someone who's older. We also talk about dental health and oral health, which is very important, and many adolescents really don't pay too much attention to that issue. And immunizations. This is the first time that we are addressing immunization at that age, because for a little while, years before in past visits, they haven't had any immunization. So now we are introducing new ones, and we definitely talked to them about those illnesses that can be prevented with immunizations that we have available now.
Right, and I guess sexuality might be something that a teenager would be more comfortable bringing up with you than perhaps asking questions of a parent.
Absolutely, and we discuss from abstinence to what their peers are doing, how they feel comfortable with the behaviors they see around, and also what they are experiencing now. This is also a critical time to discuss their identity. Some youth may be confused about who they are. They may feel that they have different sexual orientation, and perhaps there's a time of confusion because their brain is developing. So we help them through that time, and also we help them to talk to their parents about their fears that they may have about sexual behavior issues.
And TB screening is also on your list. Is that something that's new, a new recommendation for adolescents?
Tuberculosis screening really has been an old recommendation, but we emphasize now that for teens who really need to be screened because they are at risk, they may be living in situations that are unique, such as group homes, or they may
crowded
environment, and they may be having relatives who come from overseas. They may travel now to different places overseas,
right,
and they may have been in contact or exposed to TB. So this is the ideal time to start screening for it again.
I would think that adolescent girls have some questions about menstruation, especially the younger ones, 11, 12, 13-year-olds. Is that true?
Young girls are very, very worried about their menstrual periods.
Really?
Yeah, experiencing menstrual bleeding for the first time is a very unique, really,
that's true,
experience with their bodies. So many of them are not prepared to do that. So before they have their first period, this is a time when we talk to them about what is going to happen and prepare them for it. Also, we discuss what is normal about their periods. Adolescents may have the first 2 years of their cycle, their menstrual cycle, could be totally irregular. They may see their periods one time only and don't see it again for 2 years, so they may have very irregular periods, irregular bleeding. And also we talk to them about that the period could fluctuate from 21 days to 40 days. So it's a long range.
So that way they don't feel uncomfortable or don't get worried.
Correct. And also we indicate to them that young women may take up to 5 or 7 years to become regular in what their periods are going to be like.
Is obesity a major concern now that you and your colleagues have for the teenagers out there?
The obesity epidemic is really impacting adolescents. Perhaps from all the childhood years, this is the time when we see really the highest rates of obesity. When we compare obese children and obese adolescents, we see that from the 80s to 2004, not only we double the number of young people who are overweight or obese, but it's up to 17% of them are now, or they have body mass index, which is really weight and height divided by height, that we see a big jump, and they go beyond the 95th percentile for a really almost 20% of our young people. So this is an epidemic that is definitely impacting adolescents.
And those statistics that you referenced were several years ago, so the problem really probably has gotten even worse.
Correct.
The problem continues until the statistics catch up with it, I guess.
Absolutely. And this is a major concern that needs to be addressed at the level of the family. that we use our primary care visit to really discuss that. But one interesting thing is many adolescents don't think about the long-term side effects or the long-term effects of obesity. They think about their psychosocial impact. When they are young, they're looking at their bodies and they say, am I going to be attractive to someone? But they don't think about the high blood pressure, the cholesterol problems, the diabetes, and some of the other issues that really impact our young people, especially the ones of color. Obesity is really an epidemic among young women and also young men, but young women of color, specifically African Americans and also Hispanics. And we see the same trend in adolescent males, and more so in Hispanic adolescent males than African Americans too.
Well, does the body image concern act as a good motivator for these teens to try to lose some weight? They're not thinking about the health consequences down the road, but is the body image sort of a good motivator? Just like when you're asking kids not to smoke, is the fact that their breath won't smell good or their clothes will smell, that kind of thing, more of a motivator than saying, listen, you know, in 30 years you might get lung cancer?
Absolutely. And teens are, when they come to our practices, they want us to address that. When we go to school and give talks to young teens, early teens, they're also very conscious about that, and they would like us at all times to be able to address that topic, but many of them are fearful about it. So we bring it up as part of the nutrition, as part of the exercise, and we use not only that, you know, their developmental stage that they think it is important to look good, but also we bring the real education about what are the consequences, what happened when you are 14 or 15 years old. Like I had a patient last week whose cholesterol is already way beyond what an adult would have.
Really?
You know, with already hypertension, diabetes, etc. So this is a critical time when we talk to them. These are long-term consequences that could be short-term, and that you could be on adult medicine to deal with diabetes or to deal with hypertension or even cholesterol in a short period of time.
Do you advocate that adolescents have their cholesterol levels checked?
Absolutely. This is part of the primary care visit. They should have it during the beginning of the period of their adolescence. And for those adolescents who are at risk because their weight, their body mass index is so high, because they have some other conditions, including familial conditions, we do that every year.
I've heard of something called metabolic syndrome. What is that?
Metabolic syndrome is really insulin resistance. It's the beginning of the type 2 diabetes. And this is what we are facing now, which is really different than what we were facing before, because the obesity epidemic is leading into diabetes, and this is the type 2. So the type 2 diabetes at that age is kind of slow. It's a slow progress in terms of showing all the signs and symptoms. So at the beginning, what we see is some skin conditions like we call acanthosis nigricans, which is really the thickening of the skin and darkness of the skin around the neck and the armpits or the axilla. So at that time, this is when we just do the screening, and if we see anything abnormal, we'll go ahead and take also insulin levels. But obesity is really the number one sign in terms of someone is at risk to develop that.
Oh, it's so important to get them on a different road for good health.
Correct.
Let me ask you about vaccines. We're going to have to take a break in a minute, but I want to ask you about the vaccines that are recommended for the adolescent population.
For years, we were just doing booster vaccines because all children were immunized when they were younger, and then this is a time 10 years later when we were doing the boosters. However, things have changed now. We have new vaccines, and there are 3 specific vaccines that are unique for young people now. One is the meningitis vaccine, or meningococcal vaccine. The second one is the tetanus with pertussis, which is also different than before.
That prevents whooping cough?
Whooping cough. And then the third one is the human papillomavirus vaccine.
Right, and that prevents cervical cancer down the road.
Correct.
If someone gets...
Yes, so parents are kind of surprised when they come to the practice, and we show them now how the vaccine or the immunization card should look like. And this is the time when they ask us all the questions about how important it is. Meningitis is critical. Although the number of cases of meningitis for this particular bacteria are not so high, but the young people are very much at risk when they enter college because they live in dorms, and it's really lethal. When they get meningitis, up to 10% of them can die from the disease. So it's a critical time right at the beginning of adolescence to immunize them against meningitis.
Very important. We have to take a break, but when we come back, we'll talk about the HPV vaccine and its role in preventing cervical cancer, and we'll also talk about the risk of HIV among teenagers. So stay with us. We'll be right back.